the fact of the matter is that there's been very, very tardy contract tracing, and the QR coding is not like it should have been, and this is what a large part of the problem is. We've got people running around, don't even know they've got COVID yet. So I put out on Thursday evening, perhaps it'll be a good idea if people just stayed at home. It's not mandatory. We're in the middle of a huge harvest, so that has to continue on. So we need to be very proactive and just, chill for a bit, because everybody was very busy and there was lots of excitement because everything was opening up. But we have a problem and we have to manage it. We don't like it, but we still have to manage it. So we're getting there.
Obviously a very difficult time for you and the community as well. You said, there may be people running out and about, and as you mentioned too, because it is harvest season, it's a very busy time for the town of Moree at this time. But what about testing sites? Have you set up more testing sites for people to be able to drop in to get tested?
Yes, we've had a big setup out at the gateway for quite some time, because we've been doing a huge amount of testing for the trucks to go over the border, and we've had this amazing team of predominantly women doing this amazing job for so long, and they're exhausted. Look, next Tuesday there's going to be another drive-through setup. I'm not thrilled about the time lag with that. I would have liked to have seen that happen a lot quicker. But they're also extending their testing hours at the hospital, which is really important. So we have the hospital site. We have a drive-through site that is now functioning very well. I can see on the screen there's some very big lines there, and I was part of that line yesterday morning. But it's hugely necessary that we have more testing sites, because people get frustrated. Sometimes people are incredibly busy. They have children. Sitting in a queue like that with no toilet for 3 hours can be a problem. And we need this other site up sooner rather than later. And I'm a bit disappointed it's not going to be till Tuesday. And I did say that, but they've got the other options with the hospital testing as well. They've moved the testing. Isn't happening in the body of the hospital as such. It's happening in an ancillary building, which is really important, because we don't want infected people roaming around with sick people, because people still have other issues.
One of the challenges when it comes to this pandemic too is being able to isolate safely for certain family members or so. Is there adequate accommodation for people to be able to isolate safely?
Well, some of our motels have been deemed sort of safe motels where people can go. They're very self-contained, so that's up and functioning. Sadly, the horse is well and truly bolted with this, because the event, we've had sewage detection for 3 weeks now. So, and then there was a big funeral, and there should have been more policy and procedural following at that funeral. Sadly, there wasn't, and that's become a major issue for families, and a lot of the families are together and living together that have the problems. As of yesterday evening, we had 74 cases. So in retrospect, and if you look at the ratio of that on Sydney, that would equate to Sydney having probably maybe 60,000 cases in a week. So we got a problem on a population ratio.
But at the same time, I read that the member for Northern Tablelands, Adam Marshall, says that this is what living with COVID looks like. Do you agree that this is something that we should just accept?
No, I don't agree. And we know that we do have to live with COVID, and that's a given, Adam. But we do need to live in a situation where we have resources, and we still don't have the resources. Like, we're not going to have a second testing site till Tuesday. That's a week and a day past our first case, sorry. So, look, we do have to move on, and we do have to live with COVID, and we need more vaccination rate. The worst thing that happened in our community, somebody thought it'd be smart in northwestern New South Wales to tell the Aboriginal community that vaccination's white man's poison. Now, that is a huge issue, because COVID has no racial barriers. Doesn't care if you're fat, thin, short, rich, poor, whether you come from one part of the world or another, or what religion you are. Just simply doesn't care. So that just breaks my heart, and I'm actually really angry at how this has happened, because it needn't have happened, didn't have to happen. A little bit of procedural policy following, and some vaccination rates that should have been better than what they are, and every opportunity has been given to every person in this shire and in this district to have multiple vaccinations. So, I'm cranky, but there's no point in being cranky because it's happening and now we have to deal with it.
At the same time, though, Katrina, the latest data shows that the Moree double-dose vaccination rate is about 80% or so. So what's being done to try to ramp this up even further?
Oh, look, we have been trying. You can lead a horse to water. This old bush saying, you can lead a horse to water, you cannot make it drink. The opportunity and the effort that has been put into getting the rest of the vaccination rate up has been enormous. We have had so many agencies here. We even had the Royal Flying Doctor Service come and set up a vaccination hub. And the vaccination rollout has been going here since May. We've had some very, very proactive people in the community, and we've just got this minority of people that just put up a brick wall and they say, nah, we're not going to have it.